Welcome to the Executive Shift podcast with your host, Kim Borchers, where we explore the pivotal moments when accomplished leaders step out of the private sector and into public service. Today's episode is presented by Bird Dog Recruitment and Consulting.
Hello and welcome to the Executive Shift. I'm Kim Borchers with Bird Dog Recruitment, and we are excited to have you joining us for the next 30 minutes. And our guest today is Dr. Arvin Singh. He is the Secretary of Health for the great state of West Virginia, and I know you will learn a lot from this conversation. As you all know, I'm always excited about all my guests, but Arvin, out of all the people who I've interviewed, Arvin is someone who I came across about a year and a half ago when doing a search. And I have just found him to be an amazing human being, and I'm so delightful. I twisted his arm, I think, to go to West Virginia. But Arvin currently is the Secretary of Health in the great state of West Virginia. He's also the Acting Director of Rural Health Transformation. And prior to that, he was working at the University of Maryland's medical system as the Vice President of Strategic Planning and Communications, External Affairs. Boy, that's a mouthful. And even then before that experience, he was at the Odyssey House in Louisiana. He was the Chief Operating Officer. So Arvin, welcome to the Executive Shift. I'm so delighted to have you with me today.
Thank you for having me, Kim. I'm excited to be here.
I loved those pictures on Facebook, seeing your family. You were at the Easter egg hunt, weren't you? Didn't I see you at the Easter egg hunt?
Yeah. I have three little boys, and they are fascinated with eggs and chocolate and searching for things. So it's always an exciting time.
That's awesome. And Arvin is married to a delightful, amazing and brilliant physician. And so I'm sure she keeps you in line. I can't imagine her having all boys in the house. That's crazy. But she's the queen. She rules.
It's a very physical stage. Anyone who's had kids 4 and under, it's extremely physical.
Amazing. And you know what, though, when your kids get older, you might wish going back to that because you actually still have control once you get into that,
true.
that mental side as they get into the teen years. But, first of all, there's many reasons why I wanted to have a conversation with you. But one is because you are kind of that millennial generation of leaders. And I think that perspective matters, especially as you're coming into state government, because there are a lot of people who you are leading that you are significantly younger than they are. But before I go into that a little bit, when you stepped into this role as the Secretary of Health, what did you think it would require of you? And then you quickly learned something instead, that it was something different.
Yeah, I tried my best to prepare in advance. I talked to a lot of current and former secretaries of health across the country, talked to sitting CEOs, my former boss, my boss's boss, just to get an idea. And I don't think no matter how much people prepare you, it's always a unique situation you enter in. Because even if you talk to probably former people in this current role in this state, it would be different. But I came in, I'd say, expecting a largely strategic role, big vision, alignment, long-term planning. And that's definitely a big part of it. But I think the biggest part of this job is it's really an execution job at a large scale. What you're doing is you're managing, whether it's state timelines, federal timelines, some legislative dynamics, political dynamics, operational constraints within the department, within the state, and you're managing real lives at the same time. And there really is no margin for delay. It's zero. So what I feel like I had to learn quickly is that you have to have strategy, but it's irrelevant without speed. Execution speed is so critical here. Also, we're here for a short time. I mean, 4 years sounds like a long time, but it really is not. And if you want to have impact and change, you have to have not only yourself, but your team willing to move at speed. And you really need a bias toward action, clear accountability, and discipline to move initiatives from that concept, that strategic concept, to implementation. And that's where the impact really happens.
So do you, and I'm not going to get to the other question yet, but you talk about speed because nobody thinks of speed when they think of government. They think of like trying to run through molasses. And so do you think it was your prior roles in recognizing that? And how have you been able to motivate people to maybe shift to speed where that probably wasn't where they were normally landing every single day? Or maybe I'm wrong on that.
Yeah, there's definitely a external culture of government is slow. I think we have a lot of good people who work in government, a lot of good people, and they
Yep.
want to move fast. They want to get things done. But coming from large institutions, whether it was University of Maryland Medical System or Johns Hopkins, University of Maryland, for example, employs over 30,000 people. So there are politics within those systems themselves. There are
Right.
processes as well. So there's a lot of similarities. It's just your willingness to move through it, move quickly, and then look at your processes differently. There's legislation, there's code. You have to always abide by the legal bounds of what you operate in, but there are ways to make sure you can put a new lens at your current processes to optimize them. Even with our new program, Rural Health Transformation, we recognize that speed is a critical part of that program. So when we stood up the authorizing bill for this to be approved, RHTP at West Virginia, we also pushed through exemptions to allow us to procure quicker so we could move through the process quicker. So it's identifying where those bottlenecks could be and try to get in front of them. But yeah, speed is not, it's hard to do in government, but it's not unachievable.
So I mentioned kind of in our opening about you being a millennial. And let me just ask you, how have you managed that dynamic leading the change process with, like I mentioned, folks who they've been there longer than you and are probably significantly older than you? How have you managed that?
I've been used to that, whether I was a COO years ago, and I try not to lead based on age. I lead based on really the clarity and results. Many of the individuals I've worked with have decades of experience, and I respect that. I leverage that. I make sure that they're in a position that is either advisory or operational to make sure all of us succeed. My role is not to replace that experience, it's to align with that and focus on outcomes. So what has worked is being very clear on that direction, transparent with all the staff on expectations, consistency and follow through. And when people see you make decisions, stand behind them, work to remove barriers, I think trust builds pretty quickly, regardless of age. And I've had to learn quickly that credibility is earned through that action, not title. And I definitely see it coming into play because I have assembled a team here. I have brought in an entire new team. The Rural Health Transformation team is a good example that I personally hired in conjunction with the governor. And some of those people I was able to bring across state lines from former jobs and lives that wanted to work here, that took pay cuts to do this, to have an impact, to have the opportunity to have major, major change in health. So earning trust is critical. And once people see progress, not just plans, I think they get all on board and solidify in that direction.
Yeah, that really kind of can motivate a team when they begin to see kind of a breakthrough. And I love how you mentioned people taking pay cuts, right? I mean, but sometimes those pay cuts, you get a title for something that the title's pretty great. The pay may not be, but man, the things you get exposed to and the experience you have is absolutely phenomenal. From your perspective, what leadership gaps concern you the most, especially in your generation and the generation to follow? Is there anything that you're seeing that's kind of a red flag that you feel like folks need to be looking at?
I don't know if it's generational, but I've seen it in different jobs. I'd say the biggest gap is lack of operational ownership. So there's a lot of focus on ideas, strategic planning, positioning, but a lot less on emphasis of execution or accountability.
Mhm.
Accountability is huge, and follow through, and seeing something to the end, even if it becomes difficult, and having people take ownership of the entire process, especially through end. And when I mean end, I mean also tracking outcomes is challenging. And public service, especially, requires leaders who can operate inside constraints and still deliver those outcomes.
That's a great point. I remember sitting in meetings and I would say, "Well, who's responsible for this?" And I would have three cabinet secretaries and everybody's looking at each other and I'm kind of thinking, this is why we have a problem, because one person isn't saying this is mine, right?
Yeah.
And then coordinating and collaborating. So from your perspective, I mean, you mentioned about bringing some folks in. How do you identify talent and prepare people actually for public service? Because I get when you say all these other organizations, they're big, they have their own bureaucracies. You and I both know there's bureaucracies in private sector. But how did you prepare them for the public service side? Because it is different.
I level set expectations depending on the job they're going in. Of course, they're going to get the beauty and honor of serving, which is amazing in its own right. But you have to have those expectations clear of what the sacrifice is going to look like, the long hours, and being very upfront about that. For example, with RHTP, I was clear with the staff. There's not a training manual. We are all going to build the plane as we fly it, and we need to work together. We're bringing in subject matter experts, and we're going to work together to do that. So I look for a couple things: people who are willing to take ownership, people who are willing to solve problems without being asked. That's important. And people who follow through. So preparation, to me, it's not theoretical. It is exposure. And if you give them real responsibility early, clear expectations, and then let people operate without having to micromanage, then you can coach in real time. And I think that's how leaders develop, not through observation, but execution. And I've seen a lot of success with that. I hate micromanaging, and I rarely have to do that. And if I have to do that, then there unfortunately are adjustments that are needing to be made. But there are still people who, after micromanaging, get on the right track. So some people just have to learn differently. But I personally don't operate through micromanagement. I like folks to take the reins, take ownership, and just have the same mission and mindset that we all have. So if you bring people who have similar values and are marching in the same direction, you really can have a successful team without micromanaging.
Well, in the area of public work, I mean, when you think about the skills that are essential for your team, which ones, from your perspective, are the hardest to teach? Like, we actually need this skill set. Have you come across one in the past 18 months that you're like, okay, wow, this is a hard one?
That's a good question. I would say judgment is a good one. So you can teach frameworks, you can teach policy, but the ability to make a decision with incomplete information, then stand behind it under pressure, whether that's legislative pressure or executive pressure, that's hard to teach. But and you need people who are willing to do that with that limited information and make
Mm-hmm.
their best possible assessment, because we move very fast. We could get in public health, you can get calls about anything. We've had oil leaks, we've had water issues, we've had epidemiological issues. You need people who are willing to take those judgments and stand behind them, communicate, and tell us why based on their experience. And I also say resilience is another one, because it goes hand in hand. public service is not easy. You have to absorb that pressure without losing focus on the mission in front of you, whether it's a disaster or long-term planning. You have to be resilient because you're going to get a lot of pressure from both sides, left, right, front, center, asking you, why are you doing this? Why aren't you doing it this way? So to be able to stand behind that, it's very critical. And having resilient folks, it's a hard skill to teach.
So if I'm hearing you correctly, it's really about people who have the willingness in some ways to take risks, because that's what part of it is, right? Judgment is a risk. I mean, you're putting your money on, I really believe, based on what we do know, that this is the right path, and then let the chips fall where they may. And it's extremely hard. And it's probably why you have a lot of paralysis in government, is people are scared to take the risks.
You are spot on. You are spot on.
And I've always told people, when people say, oh, well, government and business, it's the same. And I said, not really, because your name isn't at the top of the fold of the paper every single day in private sector, unless you've stolen something, right? Or there's just some big scandal. But these types of things, and I always thought it was amazing when people are like, what? People can make mistakes. I'm thinking, no, there's not a lot of grace in this business. So with that kind of being the backdrop, even share your own story of when you kind of were moving up the ranks and getting more responsibilities. What was a mistake that you made early in your career that someone allowed you to make that mistake? And what did you learn from it?
Yeah, I've made some mistakes. And I would say, just broadly, I think folks, leaders especially, should be given that grace to make those mistakes, especially execution mistakes, as long as you own them and you learn quickly. I don't want to get too personal, but yes, I have made some mistakes, and a lot of folks around me have made mistakes, and I've given grace as well, as long as they share with you, communicate, why did this happen? And it goes back to, in healthcare, we talk about a just culture. If you've ever heard about the just culture algorithm, where sometimes it's systems failure, sometimes it's lack of training. There's a lot of reasons mistakes happen, and not all of them are because the person willingly or made the mistake because they wanted to make a mistake. There's lots of dependencies that could cause those mistakes, and having a just culture, I think, broadly speaking, beyond healthcare, is important, especially if you're going to develop good leaders who are willing, to your point, to take those risks that are going to need to happen to make quick decisions in a vulnerable industry. We are in a low risk or high risk industry, just healthcare, similar to the nuclear industry, where, zero harm is critical. You can't make a mistake, otherwise it could lead to a massive negative outcome. So having some of that grace is important, and having a just culture, I think, is equally important.
Arvin, I remember I made a very big mistake in the first year I was working for my governor. And when I think about it to this day, even at the time, I made such a big mistake. I was sitting outside of his office, and it's like when you wreck the car and you're waiting for your dad to come home because it's going to be a problem. And I'll never forget him standing in the doorway, and I was ready to resign, and he wouldn't accept my resignation. And his comment to me was, how many people have you brought into my administration? I said, hundreds. And he goes, yeah. And I knew you were going to make a mistake sooner or later. You're not resigning. And there were plenty of other governors. I know there were other people that would have had my head on a chopping block, and I would have been rolling down the street. They would have. But he was so gracious to me, because it's like you said, nobody goes into these jobs going, yeah, I'm going to make a mistake today on purpose, right? You don't. Did I learn a lot from that? I learned tons. And there are things that we did differently just to make sure in the future that something like that could never happen again. But I was so grateful. I was so grateful for what he did for me. And I try and bestow that same thing on people who work for me because that level of grace was bestowed upon me. Um, Let me ask you, what gives you hope about the future of younger people coming into public service? What are your thoughts on that?
Like what I mentioned earlier about I've had the ability and honor to hire some really good people who've moved here from out of state who have really made some sacrifices, and I have a lot of people I communicate with who are wanting to and really have a desire to move here to West Virginia to work for this department, work for this governor. I think what gives me hope is that there are still those people who want to do meaningful work. And I think when you give younger leaders real responsibility and tie their work to outcomes, or as the governor likes to say, needle movement, that actually matter, whether it's chronic disease, access to care, health, workforce participation, community impact, I think they respond. People have a desire to be attached to some sort of outcome and change. That appetite to make a difference is there. It just needs to be directed and structured sometimes. And that's what we've done here. And I'm seeing a lot of folks who want to work in state government, work for this department in particular, and it's been really nice to see. And just in the RHTP work as one example, we had a lot of applicants for all the different roles, and there are still applicants to this day who were top of the list that didn't make the cut, that have been reaching out. Is there anything else? Is there another way I can get engaged? I really just want to help the state. That gives me a lot of hope.
I love that. That's fantastic. Well, I would just say to the folks who are listening, I remember when you and I had our first conversation, and I thought, this is exactly the kind of talent that needs to come into state government and really transform it. Because I think in states like West Virginia, these smaller states, what a way to create a template for
Yeah.
how things can be done well. Because, West Virginia is not New York, it's not Florida, it's not Texas, it's not California, but West Virginia is similar to a Kansas or a South Dakota. I mean, there are a lot of similarities because of the size, and the rural population really is impacted. Even though the challenges that are there, the reason for the challenges may look different, I think the ideas that can transform the lives of people are important. And you have such a heart for wanting to create environments for people to flourish. And I think just your work in Louisiana probably gives you a tremendous connection to the people of West Virginia too. You understand the population. So on the lighter side, this is our fun side as we wrap things up. Or actually, before we get into this, if you could be sitting across from someone right now, because you've done this already, because you've recruited some people in, anybody who's listening, that's like a C-level suite talent, that's, what would you say to them why they should come in and consider working in state government for a governor as a cabinet secretary? Why should they make that sacrifice? Because that's what it is. It is a sacrifice.
First, it's a rare opportunity. You could go your whole life and never get that phone call. You could go your whole life and never even meet someone who's ever gotten that phone call. I remember before I took this job, I was looking up how many cabinet secretaries have there been at a state level in the United States in the history. And it was like, I don't remember what the calculation was, but I think it was under 10,000. And if you extrapolate that to the total population over time, it's a small number. So first off, the ability to even get that phone call is a blessing and an honor, but the impact that you can have is massive, that you can have positive change at an entire state level. Again, it's an absolute honor. At a selfish personal level, yes, making the network connections, meeting people, it's amazing for your own growth and your own experience, but from a citizen level and the impact you can have to actually have realistic outcome change for citizens of your state, It's incredible. And I would recommend everyone to really consider, if you ever get that phone call, please consider it. It is once in a lifetime opportunity, and you will enjoy it. Life is a story. Why not add a little bit of an exciting chapter into your life?
I love that. And what great fun for your kids. The stuff your kiddos have been able to participate in with a governor. There's not a lot of kids who can say, "Yeah, when I was growing up, this is what I did. My dad worked for the governor." It's just I love it. I love hearing my kids tell the same stories now that they're adults. So let's get in on the personal side. I always ask every guest this question. What is the best book that you have read recently or are currently reading?
So I haven't read a book recently because of my job, but I have read a lot of articles and a lot of scientific journals. I'm
Okay.
sure people will always say they read, I don't know, Good to Great, The Hard Thing About Hard Things. I have watched, I've had the time to watch a couple movies recently. I saw Oppenheimer and Top Gun, and I like some of those movies, and even some articles I've read that sort of go to the same principle. I think both of them, whether it's Oppenheimer or Top Gun Maverick, they're practical. It reinforces that leadership is not about ideal conditions. It's about making really, really tough decisions when there are no perfect answers. And I think reinforcing that leadership decision making, as I said earlier, having to make it with limited information, especially under pressure, it's critical. And it has ripple effects well beyond the moment that you make that decision. And it's critical to perform as you train the next generation as well. As you could see in the movie Top Gun, you got to perform yourself as you're helping train the next generation. That's what I'd say, not to sidestep the book question, but I've read Good to Great and all those, and they're great books, but recently it's been more movies and articles.
Arvin, you're the best to be able to incorporate Maverick.
And podcasts. I do watch podcasts too.
Okay, so what's your podcast? Do you have a favorite?
Yeah, I'd say recently I like Patrick Bet David a lot. Patrick Bet David's amazing. And actually, when I went to Melania, the movie premiere, I got to meet him. And I like what he does because his podcast breaks down leadership, business decisions in a practical way, especially around risk. He talks about his personal story, accountability, thinking through different consequences of those decisions, whether it's first order, second order, third order consequences. And he focuses a lot on ownership and entrepreneurship and taking responsibility again for those outcomes and building systems, just like he built his business. So I love that podcast a lot. And he brings in leaders from different disciplines, left, right, center, and they have really good practical discussions on performance and decision making.
I love that. That's fantastic. Okay, last question. What's the best advice you were ever given?
It's a good question. I'd say recently it would be focus on, and this is what we're doing at the department, focus on outcomes, not activity. Move the needle. It's easy to look busy, especially in government. You can have meetings, plans, discussions, but at the end of the day, the question you can always ask yourself, did anything actually change? And I think that advice has stuck with me. Did you actually see any movement and change? For example, we have, I'll just name, or not going to name any state, but whatever state you work in, you can hear almost on a daily basis all the wonderful programs that are happening in that state. But if you look at the broader metrics and they've gone down, not even moved, but gone down, you have to ask yourself, are we really doing anything? Are we actually instituting programs that are changing the broader dynamics? And that's something I ask myself always. Every dollar we invest, we have to be responsible with that taxpayer money. and actually move the needle. So that's become my mantra at this point, is outcomes and needle movement. And that's how we've been operating this department. So I think that's good advice for anyone.
Love that. Dr. Arvin Singh, it has been an absolute pleasure spending the past 30 minutes with you, and what practical advice you've given everybody. It's absolutely fantastic. So, folks, this is what the great state of West Virginia looks like and the folks that are leading there. And we need more people like Dr. Arvin Singh coming in and helping all of these governors who will be winning their elections in 2026. So thanks for inspiring and laying the groundwork. And it's a privilege to be friends with you. So thanks, Arvin.
Thank you,
Have a
Kim.
great one.
You too.